Hey guys, it's Dr. Braddock. I want to share something that I think is absolutely awesome with you today. It's something that I've just recently heard and it made so much sense to me, and I wanted to share it with you. And what it is knowing the difference between a change and a shift. Alright? Because they're two different terms that have really different implications on your life. And I want to give you some examples. That's the easiest way to kind of get the difference in these two. But if someone's going to make a change, say a change in their health, we have people every week come into our office that are looking to make a positive change in their health. They're doing all sorts of cool things. This is maybe the person who is giving up sweets, or they are starting to cook more healthy meals or eat more fruits and vegetables, less processed foods. They're getting adjusted regular. They're trying to take less medications. Overall, they're making tiny choices, changes in their health because they want to see a positive change. Okay, you could also liken this to the person who's going to quit smoking. That's a positive change. They want to, just for one reason or another, they decide they want to quit smoking. Maybe they're going to do the patch. They're going to do the electronic cigarettes, or they're just going to go from a pack a day to, a half a pack a day to a few a day to one a day. And they're going to positively try to make a change. That's a great thing. Unfortunately, sometimes when people make a change, it's not a permanent change. Smoking especially. I know people in my life that have smoked a long time. They try to stop that, and it's a struggle when you're just making a change. Now the difference is when someone decides they're going to make a shift. All right, when they're actually going to shift from one place to the other, that's when that person goes to the doctor. The doctor looks on their X-ray and says, "You have a spot on your lung." Right? You can imagine that person goes home, they throw the cigarettes out the window on the way home. They're done, right? They're not going to make a change. They shifted their consciousness. They shifted their thinking, and it's a bigger deal. And with me, that's why I wanted to shoot this video. This week I've had 2 patients come into my office. These patients aren't your typical patient you would consider a health-minded person, if you will. They're people who, they drank a lot, they drank and they smoked, and they really didn't pay attention to what they ate. So they really led a pretty unhealthy lifestyle, and both of those people have told me just this week that it's been, for each of them, it's been a little bit different, but a couple of weeks since they've had a single drink, since they've smoked a cigarette, since they've even had coffee, soda. One guy's completely given up sugar. They're both males, actually. And so I said, I've got to know, and it wasn't like they were just trying to cut back on some things to make some changes. They shifted into a whole different place. People that you probably would have looked at earlier and said they can't do that. They would have looked at themselves and said, I can't do that. Those things I've been doing for a long time. I like to do those things. I enjoy them. But no, they made a shift. Turns out both of those guys had gotten some bad news in terms of their health, right? They had gotten diagnosed with something, or mentioned that there could be some issues that were arising, and basically scared them into a shift, right? So what my idea is what if we tried to find that, we tried to identify that, and make a shift in our life rather than just a change, without having to get to the point that we're scared into that spot, right? Or that we have abused our body to the point that we have to make a shift just to live. What if we decided to make that shift right now just to be healthy? Just to be a healthier you today than next year. Because whether you know it or not, the decisions that you make today will affect how healthy you are down the road. Sometimes I get some seniors into my office, maybe people 60, 70 years old, and they come in, that they're in the time of their life they really want to start to enjoy things. However, they have done things over a lifetime that has put their health in a position that they don't get to do that anymore. And unfortunately, there's no crystal ball. You can't undo those things. There's certain things that we can do now, palliative care, to try to get them a little relief, but what if they would have made a shift 20, 30, 40, 50 years ago? They would be living a cruise ship lifestyle rather than a nursing home lifestyle or an assisted living home lifestyle. That is another video that I'm going to talk to you about, because when we do these decisions, we make these changes today, it's actually going to make a positive effect for the future. You don't wait till you retire to start saving money, right? You shouldn't wait till you get there to start paying attention to your health. You should do that today. Hopefully that makes some sense to you, a shift versus a change. We love people making positive changes, but if you could just actually make a shift, done, right? It's a cool thing. Thanks for letting me talk to you. I enjoy every minute I get to spend with you. I'll see you at the table. God bless.